Dr. Michael, shall we start our session? Good evening, everyone. This is Hannah Muhammad from Friends of Cancer Patients Society. Friends of Cancer Patients and in collaboration with the University of Sharjah are honored to present Dr. Michael Ekubu, Assistant Professor in Health Care Management, University of Sharjah, who will be presenting for us a session regarding the colorectal cancer among women in UAE, prevention and early detection. Ladies and gentlemen, kindly keep your mics and cameras off. And if you have any question for Dr. Michael, kindly drop it in the chat box and Dr. Michael will be answering it after the end of the session, inshallah. Also, there will be a certificate and the link for that certificate, it will be shared with you at the chat box as well at the end of the session. Thank you, Dr. Michael, for joining us today. And we are very pleased and honored to have you with us. Please, I will pass the mic for you to start the session, please.
Thank you, Hannah. Again, welcome, ladies and gentlemen. If some of you are lucky to be listening to me for the second time, then you may know that my accent is a little exotic. I'm Australian made in Uganda. So you can see that that makes me exotic, and I'm living in the land of Arabia and learning Arabic, which I'm not able to. So please, if you're not able to pick something I'm saying, do not hesitate to ask me to repeat. Colorectal cancer among women in UAE. We know there are a lot of bigger things that many people would rather want to talk about, but to me, it's extremely important. When we look at the UAE and the world in general, the common cancers that create a lot of trouble in the health and well-being of everybody is colon cancer, lung cancer, breast cancer, cervical, prostate, and skin cancer. Now, I kept struggling, wondering which one should I pick. I can't pick breast cancer because I know a lot of work is done by the Pink Caravan on that. So I looked at the next terrible cancer that is creating a lot of trouble. Colorectal cancer was among the top. Now, what is this colorectal cancer? The practical definition is that it is a cancer affecting the colon, the large intestine. And that large intestine includes what they call the cecum and the rectum. And the anal canal, as we can see in that picture, are not considered in the definition and are treated as separate entities. But colorectal cancer is mainly the large intestine, which starts from the cecum all the way to the rectum. How common is this colorectal cancer? It's the second most common cause of cancer-related deaths in North America. In UAE, it's the third leading cause of cancer deaths. And it's also considered the fourth most common cancer in men and women combined. It's the third leading cause among women, but the fourth most common among men and women combined. And this was a longitudinal study that revealed this study in 2012. Like all cancers, up today we are still struggling and will continue struggling to understand what brings about cancer. And if we can understand the cause and how cancer, where it comes from, then we may be able to successfully work out a mechanism of treating and preventing cancer completely. Because we don't know, one of the best strategies is early detection. Regular screening can prevent the development of colorectal cancer through the detection and removal of the precancerous lesions. And the risk of developing these of colorectal cancer increases as we grow younger, as we grow older. I like to think we are growing younger, but they say we are growing older. Just like the rest of the cancers, the older you grow, the more risk you face to develop one or the other. Medical conditions such as polyps, inflammatory bowel syndromes increase the risk of developing colorectal cancer. The Health Authority Abu Dhabi recommends screening for colorectal cancer for men and women from 40 years of age to 75. There's also a fecal examination once every 2 years, or by the colonoscopy once every 10 years. And data and research indicates that colonoscopy is one of the best ways of screening for the presence of colorectal cancer. Now, something from the US. The American Cancer Society recommends every man and woman 50 years and older begin testing for colon cancer. But you can see the difference. The UAE has realized that we do not need to wait to 50. We should start from 40. And there must be a reason. And this was a very strong study that was done. And they found that most people are getting younger who are developing most of the cancers, not just colorectal cancer. Yearly fecal occult blood tests need to be carried out. Flexible sigmoidoscopy every 5 years. The yearly fecal occult blood tests plus the flexible sigmoidoscopy every 5 years, preferred over either test alone. Instead of going with the number one, which is the yearly fecal occult test, or going with the flexible sigmoidoscopy every 5 years, it is preferable to take a combination. it increases the chances of detecting this cancer. There is also a double contrast barium enema, which should be done every 5 years. These are according to the guidelines of the American Cancer Society. And a colonoscopy every 10 years. And that colonoscopy is the best test money can buy. If there is anything you suspect, please talk to your healthcare provider.
Dr. Michael, sorry for interruption, but I
Yes.
think we cannot see the presentation. Can you
Oops.
share the presentation? Thank you very much.
Sorry. Where am I? Where am I? Where am I? Anna, anybody who can help me?
Yes, doctor. You can see share screen down.
Oh, okay. Let me see. Okay. Yes.
We can see it now, doctor. Thank you very much.
I think I'm in a little bit of how can I switch?
You can see the display settings, doctor.
I've got two screens.
Click the display settings on the lower and the upper left side.
Upper and lower left side.
Display settings.
Display settings, yes. Thank you, man. You're a genius. Yeah. So, we go back to the beginning. The common cancers, as we all know, involve colon, lung, breast, cervical, prostate, and skin cancer. I don't know how common it is how common skin cancer is in UAE, given that we know how deadly the sun is, and we don't have time to spend outdoors, so we may be safe from that. But there are few cancers which are deadly here, and I chose colon cancer as one of them. Colon cancer, often referred to as colorectal cancer, is a cancer affecting the colon and the whole and other parts of the colon, such as the cecum and the rectum. The anal canal and the appendix are not considered in this definition and are treated as separate entities. So our main interest is the colon itself, the large intestine, and the cecum and the rectum. It's one of the second most common cause of cancer-related deaths in North America. And in UAE, it's the third leading cause of cancer deaths among women. When you combine, it's about the fourth most common among both men and women combined. Now, like all cancers, we don't know the origin. We don't know where it comes from. We don't know. We only know that the cells just run crazy and things go out of control. The best treatment, is either prevention or early screening. And there was a study done in Abu Dhabi. They found that regular screening can prevent the development of colorectal cancer through the detection and removal of precancerous lesions. The risk of developing this cancer increases with age. And as we know, the older we get, the wiser we become. There is a trade-off. The older we get, the more susceptible to all the illnesses, including cancer, we become. Medical conditions such as colorectal polyps and inflammatory bowel syndromes increase the risk of developing colorectal cancer. The Health Authority of Abu Dhabi recommends screening for colorectal cancer for men and women, starting from the age of 40 up to 75. Fecal exam should be done once every 2 years, and a colonoscopy once every 10 years. But the American Cancer Society suggests that every man and woman should be tested from the ages of 50 and above. UAE is a step ahead and suggesting it should be from the age of 40, because there's a lot of evidence that most of the cancers are beginning at early ages. They are no longer the old people's disease as they used to think. It's a problem which is starting at much earlier ages. So it's recommended by the American Society that yearly fecal occult blood test, FOBT, should be done. The flexible sigmoidoscopy every 5 years. However, if we combine the two, the FOBT and the FIT, plus the flexible sigmoidoscopy every 5 years, we get to detect more cases than we would detect if we used separate tests. So the question is, where do we go? A double contrast, of course, occurs with the barium enema every 5 years and the colonoscopy every 10 years. And the colonoscopy is considered the best test one can have. And if you suspect you've got a problem, then talk to your healthcare provider. This is a pictorial example of what a colonoscopy is. A special tube goes through the rectum all the way, and we can tell whether there are any polyps on the way or not. If you look at this, if you look at this small picture in the middle, you can see that this camera will show us a polyp somewhere along the colon. And if we can see that, then we know that is a source of trouble. If it comes to that level, then we try treatment. With the treatment, we have to do surgery, and it's potentially a curable disease. Curative is a wide resection of the lesion, so there would be surgery to slice off that part of the colon where the polyp is, with nodes and so on. And then, of course, that will be followed by palliative care. If a distant spread, then the local control for hemorrhage or obstruction will be looked after. And you'd find that about 80% of the recurrences occur within 2 years of the resection. So if it goes this, stage 4, it's really difficult to look for a way of reversing the problem. Improved survival if the metastasis consists of solitary hepatic mass that is resected, and the colectomy involves most patients getting primary anastomosis. And if cancer is below levators in the rectum, the patient may require an abdominal resection with a permanent end colostomy, sorry. And especially if a lesion involves the sphincter complex. Complications may arise, such as an anastomotic leak or stricture, recurrent disease, pelvic abscess, and so on and so forth. Normally, this goes hand in hand with radiotherapy and chemotherapy. Chemo for patients with node-positive disease, radio for patients with node-positive or transmural rectal cancer, pre, plus or minus post-op. Not effective in treatment, unfortunately, for colon cancer. Chemo is good for the colon and radiation for the rectum. Palliative chemotherapy and radiotherapy for improvement in symptoms and a little bit of survival. So you can see, like most cancers, when it reaches stage 4 and so on, it's trouble. So what would we prefer? we would prefer to prevent it completely. We would pray that we prevent it does not occur in the first place. And there are many things that we can do to prevent colon cancer. A diet with an increased fiber content is extremely something you cannot avoid. Try to decrease animal fat and red meat. And the biggest devil is smoking. And I can see my students come back on weekend, you know, they after the weekend, they tell me, I ask them, what did you guys do over the weekend? They say, oh, we went to smoke shisha. And they're very proud to say they went to smoke shisha. Culturally, shisha is okay. But in terms of our health, shisha is even worse than a cigarette. We need to increase exercise. And that increase in exercise will help us reduce weight, either the BMI, whatever unit of measure we look at. If we pass that and we miss or we fail to address those first four issues, then we look at secondary prevention, which is screening. We must be aware that there are two categories of risk factors. Risk factors are those activities, those things in life that tend to attract cancers. If you have, say, colorectal cancer in the family, or you have a family history, they did remove a polyp some time ago, you know you are in danger. You should watch yourself carefully. Age, we can't avoid age. We're all growing younger every year. We're all growing wiser every year. The older we get, the more susceptible we get into contracting cancer. The issue of gender is a very important thing. Different males and females are very susceptible to different types of cancer because of the different hormones our bodies secrete. And those hormones either prevent us from contracting cancer or encourage us from contracting a certain type of cancer. Race, ethnic groups, Africans, Asians, Arabs, Caucasians are very susceptible to certain types of cancers. Genetics, and unfortunately, today we shall not be looking at some of these key things, the things which we cannot change. We cannot change our age. We always grow older. We cannot change our gender. We cannot change our race. We cannot change our genes or our personal history. So we have to live with them, but we have to be vigilant and monitor ourselves to see whether we run a risk of facing a type of cancer. There are those risk factors we can change. Those include the biggest, the most important, the most deadliest, the one which is a culprit in almost every cancer you can think of, is cigarettes, tobacco products, and I must repeat, shisha. I know it's a cultural thing here, but I guess people will have to take a trade-off. Culture or health. That is something you can change. The diet, we can change the diet. Obesity is taking the world by storm. We used to say that America was the fattest country in the world, but unfortunately we are catching up really fast. Almost every country now has the problem of obesity. Obesity is when you grow so fat, it's grown bigger than, putting you at risk of several diseases. The diet can solve that problem. I know some countries rely on surgery as a solution to solve the question of obesity. There is also the problem of physical inactivity, which in a way, the land of Arabia is a victim to it. There is very little room for physical activity. Either we can go to the gyms, we can go to the shopping centers, or we can wait until late in the night when it cools, is when we go for physical activity. But there is no excuse. We have no choice. We have to do physical activity. Thank God, the land of Arabia, alcohol use is minimal, or is not there. But when you go to the Western world, Australia, the US, France, and so on, UK, alcohol is a big risk to a lot of cancers. Mouth cancer, stomach cancer, and so on. When you go to Australia, Australia is one of the countries that is really facing a big problem of sun exposure, and that brings about skin cancer. One of the key reasons Australia was having this problem was because the ozone layer, the ozone hole, which has been eaten up, is right overhead Australia. But when the government got that scientific evidence, the government went on a huge campaign. We call it slip, slop, slump. If you go to the beach, please have an umbrella. If you have to walk around, please use sunscreen, and so on and so forth. And the community joined because everybody, at least everybody, either was affected by skin cancer or knew someone or knew a friend of a friend who had been affected by skin cancer. And Australia has been very successful compared to many Western worlds in terms of reducing skin cancer. Countries like New Zealand and others are still in trouble. So how can we reduce the risk? We have to make the choices for our good health. We should follow testing guidelines. And these guidelines are so many. Every country is doing what they can and coming up with guidelines on what we should and shouldn't do and how we should do it. Just as I was explaining what is in Australia, the guidelines, much as they encourage people to do physical exercise and so on, there are still guidelines on what people should do and shouldn't do to prevent skin cancer. So for the case of women with colorectal cancer, there are a lot of guidelines. We should know our family history. We should have a healthy meal, but that meal should be well balanced. There should be good amount of fiber. There should be less amount of fat. There should be less amount of red meat. We should have regular exercise. Regular exercise is not only good for colorectal cancer, it's also good for arthritis, and it's also good for a lot of other health problems. Please, if you love smoking or your shisha, you got to make a trade-off. What do you give up? Do you give up good health and hang on to your smoke, or do you give up smoke and hang on to your good health? For those who use alcohol, please avoid excessive use of alcohol consumption. Use the slip, slap, slop method for skin protection. And that is a slogan used in Australia to help reduce skin cancer. And it has worked very well. Make those choices for good health. Eat 5 or more servings of fruits and vegetables a day. 5 or more servings of fruits and vegetables solves a lot of problems. It provides your body with fiber, and that fiber then means you don't have to have constipation of that all the time, and it's that constipation which is also considered to be part of the problem that generates colorectal cancer. Choose whole grain food meals. Limit your intake of red meat. Maintain a healthy weight. Balance the amount of calories you're taking with the physical activity that you do. Lose weight if you're currently overweight or obese, and so on and so forth. Tobacco, as we all know, accounts for more than 1/3 of all fatal cancer cases. More than 60 cancer-causing agents are found in tobacco and shisha. More than 60 cancer-causing agents. If a person stops smoking before lung cancer develops, the lung tissue slowly returns to normal. Nicotine replacement therapy, tobacco cessation, telephone counseling, and other counseling services have been shown to be very effective in helping many people quit smoking. One important thing someone in the UAE can do is to ban smoking and shisha altogether. Because when you see somebody who's had tobacco-related cancer, you'll find that they are the first people to advise you to quit smoking. And yet they were the ones who were smoking. Good enough, 90% of all adult smokers started smoking when they were adolescents. And adolescents are responsive to price of cigarettes. So cigarettes does a double job. It raises revenue and also discourages young people from smoking. When the price of cigarettes goes up, the number of young people who smoke falls down dramatically. And if the number of the young people smoking falls dramatically, that means the diehard soft smokers, the ones who will never quit smoking when they get into adults are few. That is what I wanted to share with you as far as colorectal cancer is concerned. Any questions?
Thank you, Dr. Michael, for the informative session, actually. And if the audience have any question, please drop it in the chat box. Actually, we have a question from Mr. Ayman.
Yes.
Mr. Ayman Ahmed. He's asking about how do you think, Doctor, the pandemic will affect the incidence and prevalence of the colorectal cancer?
Say that again.
How do you think the pandemic will affect the incidence and prevalence of the colorectal cancer?
That's a very tough question because we know the pandemic is also coming with its own problems. We yet don't know what else the pandemic causes. We know that the main area it affects is the lungs, the respiratory system. But we know from common sense that it discourages us from going for physical activity. We also know that it encourages us to order in food. And when we order food, we have the habit of getting food with less or no fiber. And that in itself frightens me because it reduces our ability or our chances of having high fiber foods unless we deliberately go and become keen and go for food which has high fiber. Unless we deliberately go for physical activity, it's very easy to fall back on the chair and watch Netflix and just sit in the house and eat the junk food. We'll go to the shopping center, and in the shopping center, the most attractive food is the deep fried foods with lots of salt, foods with lots of sugar, foods with no fiber. So I can only guess that the pandemic is likely to make things worse. That's my guess, because there is already evidence that ever since the pandemic came, many of us have put on weight. And that in itself is not a pleasant experience.
Thank you, Dr. Michael, for answering this question. I hope, Ayman, everything was clear from Dr. Michael's side. Also, he's asking, Doctor, what are your suggestions for physicians so that colorectal cancer is not overlooked in this pandemic?
My recommendation to the physicians is that the physicians adopt a patient-centered method of treatment. Most times the physicians will treat the complaint you present. If you present to the physician with a broken finger and you're smelling cigarettes, you're smelling alcohol, you got a red eye, there's a sign you are in a violent relationship, it's often, not always, but often the doctor will look at that as none of his or her business. But when we take the approach of a patient-centered care, then if we see that the patient is smelling cigarettes, we will talk to them and give them a referral to either a counselor or someone who will help them with their smoking. If a patient presents with a malnourished kid, we will recommend and refer them to those who can help in that line. So that's in terms of colorectal cancer. Then it's being patient-centered will then mean that the doctor looking at me will be keen to know when was the last time I had a general checkup. When was the last time I was checked for colorectal cancer? When was the last time I was checked for male cancer related problems? So much as it may take more time of the doctor to go asking those sort of questions and the patient saying, I didn't come here for this, I came here for this, leave me alone, it's none of your business. It's our obligation. Probably the cancer campaigners will have to approach the government authority that the legal apparatus be put in place, that the physicians are legally obliged to ask more questions than they should. The doctors are legally obliged to report to the relevant authorities issues of domestic violence, issues of you're carrying a baby but you're stinking cigarettes, which means that baby must be a third-party smoker. So that is what I can think of. Because I have to reveal to you, I am from public health, and public health is is everybody's business. My health will affect your health, and your health will affect my health. We now have a lot of evidence. Obesity is contagious. If we spend time with friends who are obese, we become obese because we'll be eating the food they eat. We'll be spending amount of time we are sitting that they are spending, and before we wake up, we join the club. Children, it's really miserable. You go to a shopping center, you find a 5-year-looking old kid who is many times heavier than what you would expect such a child to be. And if you're keen, next minute when the parent comes to pick that kid to walk with or something, you'll find that the parent is equal obese. So to me, the physicians have to go a step further. It's none of their business, but it's their business. It's good for them because many people come to them who are sick and they make money and they treat them. But I think they have that ethical obligation to see that the population is healthy. After all, UAE government has is working hard, is investing heavily on improving the health of the people of UAE. It's working very hard to improve the life expectancy of the people of UAE. So indirectly, the physicians and the healthcare providers have that obligation to go beyond what they've been before.
Thank you, Doctor, for answering these questions as well. Mr. Ayman is thanking you as well for answering these questions.
Thank you.
I believe that we don't have more questions, Doctor. So that was Dr. Michael Ekubu from University of Sharjah Health Care. He's an assistant professor, healthcare management in College of Health Sciences, University of Sharjah. Doctor, we were very pleased to have you today, and thank you for the very informative session, actually. And for all who attended today with us, we are thanking all of you. You can have your certificate through the link that has been dropped in the chat box, as well as if you would like to join us in such a learning session, kindly follow the Friends of Cancer Patients on the social media. We wish all of you the best. Please stay safe and see you all soon. Thank you, Dr. Michael.
Thank you. Thank you, everybody. Thank you for attending. Thank you. And if somebody goes home and thinks of a question, please drop Hannah that question, and Hannah will forward it to me, and we can get an answer to you, if I can get an answer to you. I don't have all the answers, but if I can get an answer to you, we can get an answer to you.
For sure, Doctor. We are welcoming everyone if they have any questions in any time.
Thank you.